This is a video showing administering anesthesia and monitoring a patient for dental x-rays prior to a dental cleaning. He has been fasted and has had an examination and been given his pre-surgical sedation, so he is pretty relaxed. Dr. Christensen draws up the calculated dose of the drugs that will be used to induce anesthesia, and they are given intravenously. In a few seconds, his head begins to droop and he goes to sleep. Next, an endotracheal tube is placed. It goes over his tongue and past his larynx into his trachea or windpipe. He will breathe through it during the procedure. It has an inflatable cuff to prevent water and saliva from the dental cleaning from entering his lungs while he's asleep. It's tied securely behind his head. The tube will be attached to the anesthesia machine, which will deliver oxygen and the gas anesthetic isoflurane. Next, he's placed on a wet table, where he will be wrapped in a yellow warming blanket to maintain his body temperature during anesthesia. Maintaining patients' body temperature under anesthesia is very important. They can't shiver to raise their body temperature. Low body temperatures can contribute to low blood pressure and poor blood pressure and flow through the whole body. Monitoring and supporting these body functions makes anesthesia much safer. His endotracheal tube is hooked up to the anesthesia machine, and a lubricant is placed in his eyes so that the corneas are protected during anesthesia. Christina is placing the EKG leads to monitor his heart during anesthesia. Dr. Christensen adjusts the anesthesia and oxygen rates. For small animals, the blood pressure cuffs come in many sizes. Christina has selected his size and puts it in place on his rear leg, while Dr. Christensen checks his blink reflex and capillary refill time. Now Christina is putting the probe cover on the rectal probe that will monitor his temperature throughout the procedure. Dr. Christensen checks the blink reflex, then adjusts anesthesia flow. Christina hooks up the blood pressure cuff. She's the anesthetist who will keep track of all the vital signs, the respiratory and the heart rate, the blood pressure, and the temperature. She uses a stethoscope to check the monitor to be sure the readings are correct. All the readings are displayed constantly on our monitor, and we record them every 5 minutes during anesthesia. We're now ready to take dental x-rays. We're using a digital x-ray unit, which is much faster than the film units since there's no film developing time, and the results of each shot can be seen in seconds. The radiographs can also be shown much enlarged on a computer model, so details are more easily seen. This makes it much faster and more accurate to diagnose the problems that often occur below the gum line in animals' teeth. Here we're taking our last x-ray. And this is our anesthesia monitoring machine.